people started calling me all the time. Every time anybody got sick, they would say to their friends, call Charlotte, see what she did. So I went back to school at NYU and I got certified so I could do counseling, and I opened Cancer Survival Resource Center as a not-for-profit. And I probably refer about 5 people a week to the office. And I'm always getting calls back from people who've gone through treatment. They're so grateful that I recommended treatment and the Ravici office.
We all heard, I appreciate, and thank you so much. Your emotions are very similar to other people's in that if they choose to do an alternative treatment, alternative being different than what the doctor recommends, and you still want to go back to the doctor, a tendency might be to keep it private, as if you've done something that is not yet accepted, understood, or you will be blamed for it. And half of you might think, you know what if it's going to go the wrong way? Then I'm going to get it, and look what I could have done. Now, you're here because it went the right way. Did anybody on the other side, the physicians or anybody, come to say, well, listen, I've given you the advice I knew, but I realized you did something better? How many of us physicians are willing to accept that our advice is not universal, the best, it's not always the answer, and we can refer you to conventional modalities that we know have occasionally a very limited survival. Pancreatic cancer is notorious for having the shortest survivor among cancers. Would this doctor come back and say, well, listen, I don't know what you did, but I really want to know more about what you did? No. He said, good for you. Write a book. Do something. Ravici had a passion for what he did. Well, he invented, he created, he came up with these concepts because he was a physician and he was a chemist, and he put all these together. We are carrying it on. He's not around. He should have seen that the world has opened his direction. I think it would have been very gratifying, and we all would have liked to see that. He's my grandfather's brother, and he was the closest person here. When I came from medical school, I landed in his apartment and stayed with him for a while. Did not understand what he was doing, did not believe a lot in what he was doing because it was completely different than a conventional medical school. So that was my excuse. And I'm very blessed that it took a while, but I start not only finally understanding, deciphering the mind that was behind these concepts, but also start giving it to patients. If there is a risk or not a risk, I try to minimize it. I tell patients exactly what we're doing. I tell them that we have decades of experience. We don't guarantee anything. As you were mentioning before, there are patients just like you who actually, I don't like to say, but I will, die with cancer, not from cancer. Okay? So if you accept that your condition can be arrested to an extent and you live your life, and it stays there, which is not our goal. Our goal is to continuously decrease, diminish, and disappear. Our approach has never been as toxic, as potent, as aggressive as conventional medicine. But did any of you complain of the side effects? Maybe one of you will tell me that it smells like motor oil, because I would agree with that. But other than that, you haven't said too much, because there isn't too much, right? It just tastes bad or smells bad or whatever it is. But that is the goal that I hope to carry on, to put along Dr. Ravici's work other substances that work the same way, so the hospitals would open up and or other research organizations and allow us to go in a direction that has helped patients just like yourselves. I think it would be the right thing to do. And if it would be researched correctly, instead of you needing to hide to your own doctor that you're doing something that helps you, you'd be able to either educate him or send him to a place that he can understand that these are new modalities and we have to just open up to them. Nothing wrong about conventional medicine. Sometimes it's wrong the amount of it. Sometimes it's wrong. Sometimes there's nothing wrong about it. And it does help patients occasionally. And there are certain conditions, especially not with solid tumors, but with lymphomas and leukemias, where conventional therapies are very effective. But the majority of cancers don't have yet a good answer from conventional medicine. So to open up to additional modalities, complementing the conventional, reducing the amount of conventional, or exclusively, depending on what the patient wants, is not such a bad idea. So I thank you so much for helping us carrying this idea further, and really an homage to Dr. Rivici 10 years after he passed away. Thank you very, very much.
The hardest thing any of us have had to face has been telling our doctors that we wanted to do something alternative. If you can get past, that's the hardest barrier to get past, because they'll make you feel stupid, foolish, like you're willing to commit suicide rather than take their treatment, take the chance.
That is what we hear too.
Yes.
Because patients come back, and you know what? I feel a bit like you. I don't feel comfortable picking up the phone, which I would love to. Some of them do call me. Recently, it's not here, but another patient really connected to somebody from Sloan Kettering who called me. But this is one out of many situations. I would love to be able to tell more. I would love to hear that at least they want to know. That alone would be very important. I would be delighted to meet with them or whatever to tell them. Well, I hope that this would be a step in that direction.
All of us are so grateful to Dr. Avicii, to Elena, and to you for saving our lives. Thank you.
Thank you very much.
Yes.